Hello and welcome to my presentation. My name is Isaac, and the topic of discussion will be about what led to the failure of the merge between Advocate Aurora Health and Beaumont Healthcare, two of the biggest health systems in the American Midwest. This presentation will focus more on Advocate Aurora rather than Beaumont, since Advocate was more impacted by the failure. Overview of systems. Both Advocate Aurora and Beaumont Health rank among the top 12 when it comes to not-for-profit delivery. Beaumont currently employs over 5,000 physicians, staffs over 38,000 employees, maintains over 3,375 beds, and 167 outpatient clinics while running the Oakland University William Beaumont School of Medicine and two other universities in the Midwest. Whereas Advocate Aurora employs 75,000 team members with 10,000 physicians, 22,000 nurses, and over 10,000 volunteers. They further have over 27 hospitals, 500 outpatient clinics, and cater to over 3 million patients. They are further recognized for 9 specialties. Timeline of events. As of late 2019, both organizations began potential merger conversations and signed both a non-binding contract and a letter of intent. Within the same year, COVID-19 started spreading rampantly in the American Midwest, thus delaying conversations temporarily. In June of 2020, conversations resumed and both organizations decided to proceed with integration. However, due to speculation and the lack of leadership stated by Beaumont faculty, along with the pandemic, both entities decided to part ways, resulting in a failed merger. Finances. Advocate Aurora as an entity is heavily invested in bettering their community medically. They have set aside over $50 million in medical aid and services for impoverished neighborhoods, donated over $2.5 billion in charitable care, and have saved more than over $280 million in taxpayer funding via their Medicare Shared Savings Program. Furthermore, they managed to accumulate over $2.7 billion in patient revenue, $3.3 billion in total revenue, along with $352 million in additional profit by the end of March of 2021. However, Advocate Aurora had a setback in 2020 where they incurred a $1.2 million loss in revenue due to poor work performance and the ongoing pandemic. To remedy this, it is suggested that Advocate Aurora make note of fluctuations in the market, make note of any discrepancies within the quarter, and be in consistent communication between both the Chief Executive Officer and the Chief Financial Officer. Marketing. Advocate Aurora practices a consumer-first approach method when it comes to marketing and advertising their hospital. They utilize 5 unique methods to provide their patients and their family with quality care and hospitality, which includes the Live Well application, where a patient has 24/7 access to resources, their files, and advice regarding specific needs. Telehealth, in which virtual consultations are conducted, self-service capabilities in which a patient at their own convenience can schedule, cancel, or reschedule telemedicine or in-person consultations. Digital platforms in which both patients and potential consumers and employees can further understand the core values regarding Advocate Aurora Health. And finally, consumer engagement programs in which Advocate Aurora uses a 360-degree virtual tour to attract customers and also utilize surveys, feedback, patient evaluation, along with social media. To further improve on this aspect, Advocate Aurora should post either monthly or weekly on Facebook, Instagram, Twitter, and if wanting to appeal to a younger audience, Snapchat as well. Planning. As stated prior, both organizations planned and initiated talks prior to the merge, and both agreed and signed a non-binding contract and letter of intent. However, 5 months in, and that to the eve of the merger, many among the Beaumont faculty cited a lack of confidence in leadership within their organization, further contributing to the failure of the merger between both organizations in addition to the pandemic. Ethical and legal issues. Some legal and ethical issues that further contributed to the failure would have to be the Act of Consolidation, the Sherman Antitrust Act of 1890, and the Clayton Act of 1914. Consolidation is the act in which two or more entities conglomerate to form a much stronger entity. Advocate Aurora Health happens to be the product of a merger in which Aurora Healthcare and Advocate Healthcare are the parent organizations. Both providers mutually agreed to a non-binding contract and a letter of intent which allowed the two organizations to part ways with ease. The Sherman Antitrust Act of 1890 happens to be a federal act in which it prevents monopolization and prohibits any activity that hinders competition within a market. Meanwhile, the Clayton Act of 1914 further defines the acts that hinder growth, such as the rise of monopolies and price fixing. If the merger were to have happened, it would have resulted in both financial and employee growth. Human resources. Though recognized for 9 specialties and multiple services, Advocate Aurora is still a fairly new and developing hospital. The provider emphasizes on diversity, equity, and compassion to further allow their organization to flourish. Advocate Aurora, as stated previously, has 27 providers across the Midwest, over 500 outpatient clinics, and caters to over 3 million patients. With only being recognized in 9 specialties, it is extremely difficult to provide a certain quantity of individualized care, and that as a developing hospital. It is imperative and highly suggested that Advocate Aurora further improve upon their organization by successfully implementing policies and protocols that will allow them to treat a number of patients in a given time. In conclusion, both Advocate Aurora Health and Beaumont Health are two of the largest operating not-for-profit healthcare delivery systems in the American Midwest. It is evident that employees of Beaumont Health emphasized that there was a lack of leadership within the organization and therefore not on board with the merger. To further prevent this from happening, it is imperative that Beaumont practice successful leadership qualities and recruit appropriate candidates into leadership positions. Meanwhile, Advocate Aurora should put more of a concentration on their finances, improving their quantity of delivery, and utilizing social media for marketing, advertising, and campaigning purposes. If the merger were to have happened, the outcome would have led to the formation of 35 additional hospitals, over 650 additional outpatient clinics, 108,000 additional employees, with over 17 billion as annual revenue in the American Midwest. Once again, thank you guys for your time. Have a good rest of your day.